research group of Veritas University Abuja has organized a one-day validation workshop on equitable access to vaccines in Africa. The workshop, which drew participants from the academia, civil society groups, developmental partners and government institutions, was held at Valencia Hotel in Abuja. CTV News was present.
The COVID-19 may have come and gone, but the lessons and challenges that accompanied the pandemic is still here with us. At this one-day validation workshop organized by the Health Research Group of Veritas University Abuja, these researchers are here to present their findings on access to vaccine in Africa. The gathering presented an opportunity for the stakeholders in the Nigerian health sector to deliver goodwill messages.
I would like to extend our well wishes to Veritas for this critical work that they are doing in the area of vaccine access. We'd like to appreciate what you have put in and appreciate what you have done so far, and we wish you the best. We know that what you are doing is very critical to our nation right now, and so we pray and hope and wish you well as you go further to complete your research. Thank you very much.
I would say thank you very much again for adding to that knowledge, and to say that we have really learned a lot from COVID-19, during the COVID-19 and post-COVID-19, and then we are still learning. And then we believe by the time we have another one, it will definitely come. It's not a cost, but definitely yes, it will be much more ready, like 70%.
This study that involves some African countries is actually timely, and we know that the outcome of this study, which we are validating today in this workshop, will actually help in navigating the vaccine accessibility to our people, and also help in policy planning so that we can use it to make informed decision to our principles, and that will help the country moving forward.
The coordinator of the Health System and Research Group, a group who championed the research, Dr. Emmanuel Okechukwu, during his presentation, highlighted some of the challenges in the COVID-19 vaccine distribution and why this study became necessary.
We used COVID-19 vaccine as a case study, but the findings are going to be extrapolated when we look at other vaccines and vaccinations. As we know, the COVID-19 pandemic exposed multifaceted challenges facing the health system in Nigeria. Those factors are both systemic and operational. As a result, the African Health Economics and Policy Association, together with its partners, implemented this project known as Equitable Access to the COVID-19 vaccine in 9 African countries. These African countries are Nigeria, Morocco, Ghana, DRC Congo, Ethiopia, Kenya, Botswana, Mozambique, and Zimbabwe. As was informed by Dr. Teresa, last week they were all here. 9 countries were here in Abuja to do a synthesis report of their different country findings. And part of the things we are going to present is the overarching findings that cut across Africa.
We cannot say politicians should stay on their lane and technocrats or scientists stay on their lane, because scientists generate the evidence, and it is the evidence that politicians use to make health policies. So where do we bridge the gap between evidence synthesis and policy making? So politicians cannot stay on their lane and technocrats. So technocrats are supposed to begin to play the politics of translating evidence to action by influencing policies and influencing the politicians. So there should be that handshake between politicians and technocrats. Else policies will not reflect evidence.
Even if you conduct similar study tomorrow, you will still generate some of the similar findings. However, he shared during his conclusion that there are lessons across the 9 countries that participated in this study. And one thing that came out very patchy for me is the need to have a contingency plan for outbreaks and epidemics.
Some of the participants at the workshop spoke to CTV.
This research was carried out by Veritas University on behalf of AFIA. Is an African-wide research, and Veritas University implemented it for Nigeria. Now, the research focuses on the distribution of COVID-19 vaccines, among other vaccines in Nigeria, and it sought to understand the challenges that were faced during the COVID pandemic in the receipt of the vaccines, in people's acceptance of the vaccine, in the storage of the vaccine, in government involvement, and all of that.
The research spanned 9 countries across Africa, including Nigeria. So Veritas University was the organization that undertook the country evaluation of the research around equitable access to vaccine in Africa, using the COVID-19 vaccine as a case study. Vaccine access is very important. Access includes availability, distribution, hesitancy, uptake and use of the vaccine. Many contextual issues affected the availability and access of vaccine, especially the COVID-19 vaccine in Nigeria. One of them was vaccine was not initially available. And when it became available, there were so many hurdles that needed to be crossed, including this aspect of trust. Probably people did not trust the system because there were issues that arose that questioned the authenticity and the truthfulness of those who manage the system, starting from the politicians to the public health.
This workshop is a very important one because it has to do with vaccines. And we really need to know vaccines from pot to arms. I like that phrase, from pot to arms, because a lot of research has to be done as to why vaccines are important, how people can build agency, how to create demand, funding for vaccines, making sure that all the different steps that are necessary to make sure that vaccines reach those people that need it is very important, that we take them seriously. And that's what this research encapsulates, because the COVID-19 is something that took the world by surprise. It was an epidemic, a pandemic, and we don't know when the next pandemic will come. And because we don't know, this one has set a place for us to prepare for the next pandemic. So all the results of this research will guide us on what the next steps will be.
This is an eye-opener for all of us to really go back, sit, and also look at what areas we need to really improve in terms of pandemic preparedness, in terms of finances for vaccines, and also in terms of vaccine production in the country. This will really turn around the access and also uptake of the vaccines.
For me, I'm taking home a huge learning drawn from this research on how vaccines, what are those barriers to access to vaccine in Nigeria. And it is, I want to say that it's an opportunity to learn and leverage learning. And I'm very happy I have attended this program.
In Abuja, Tony Abba, CTV News.